welcome back to my YouTube channel Medical Simple. Today I'll make you understand what is hypertension or high blood pressure. To understand hypertension, first we need to understand what is blood pressure. पहले हमें समझना है कि blood pressure क्या है. Okay, so what is blood pressure? See, you know about the blood vessels. Body is having a blood vessels, arteries, veins, capillaries. This is artery. A blood is flowing through the artery. पानी की पाइप समझ लीजिए, पकड़ लीजिए. अब पानी की पाइप से पानी जब पास होता है, ठीक है, तो आपको पता चलेगा कि पानी निकल रहा है. व्हाई? बिकॉज व्हेन द वाटर इज पासिंग, इट इज अप्लाइंग अ प्रेशर ऑन द वॉल्स ऑफ दैट पाइप. राइट? Similarly, when a blood is passing through the blood vessel, it is applying a pressure on the walls of the artery. It is applying a pressure on the walls of the artery. This pressure, which is applied by the blood on the walls of the artery, is known as blood pressure. Now, the next question is, how this blood comes to the artery? Obviously, you know that heart is pumping the blood into the artery. ये blood डाल कौन रहा है? Heart डाल रहा है. How the heart is pumping the blood into the artery? Heart is having a two positions. Two situations the heart can remain. पहला situation होता है systole, or it is also known as what? Contraction of the heart. Okay, see, when heart is contracting, it is pushing the blood out into the artery. Okay, so this is a time, systole is a time when the heart is contracting, it is pushing the blood into the artery. Okay, so imagine the situation कि भाई जब हार्ट ब्लड को डालेगा यहां पे पाइप के अंदर, ये आपकी आर्टरी के अंदर, ऑब्वियसली आपका वॉल्यूम बढ़ेगा, एक धक्का आएगा, प्रेशर बढ़ेगा, तो आपका बीपी थोड़ा ज्यादा ही रहेगा. इस समय जो बीपी होता है एट द टाइम ऑफ अ सिस्टोल ऑफ द हार्ट is known as systolic blood pressure. Normal systolic blood pressure is 120 mmHg. The next is what? हार्ट कॉन्ट्रैक्शन में ही रहेगा हमेशा? नहीं. It also comes to what? Relaxation. Relaxation of the heart is known as a diastole. And when the heart is in a diastole, it is not pumping the blood into the arteries. जब वो आर्टरी के अंदर ब्लड डालेगा ही नहीं, तो यहां पे नया ब्लड आएगा नहीं, धक्का लगेगा नहीं. Obviously, the pressure on the walls of the artery is relatively less. Okay, so at the time of a diastole, what is the BP? Normally it is 80 mmHg. So when I say what is normal blood pressure, it is always 120 by 80 mmHg. Come to what? Now the important part. What is hypertension? ये normal pressure है. When a pressure increases onto the arterial walls, जब ये pressure बढ़ जाएगा, this condition is known as what? Hypertension. So when will we say there is a hypertension? कितना pressure होना चाहिए? When the blood pressure goes beyond 140/90. Normally कितना था? 120/80. If it goes beyond 140/90, then you can say the patient is suffering from high blood pressure or hypertension. Okay, so that's it for the hypertension. For more details, you can search these links on the same channel. Keep learning.